Hi there, I am Dr. Sylvia Kim, and I am a colorectal surgeon here at MUSC Health Midlands, and I am here today to talk to you about colorectal cancer awareness. So colon cancer is actually one of the leading cancer diagnoses around the world and also here in the United States. Typically it is one of the top 3 cancer diagnoses, and it is important when we talk about colon cancer to understand that we are actually typically referring to colorectal cancer. So those are cancers of the colon and the rectum. Basically, we're talking about the large intestine. The American Cancer Society estimates that there are approximately 100,000 new diagnoses of colon cancer every year and about 50,000 new diagnoses of rectal cancer every year. So I think that it's important when we're talking about risk factors to think in terms of things that we have control over, like lifestyle factors that can be modified, and then risk factors that we really have no control over, which would be basically our genetics. So as far as modifiable risk factors or lifestyle factors, there is an increased risk of developing colorectal cancer we found with obesity, with a sedentary lifestyle, also increased incidence with tobacco and alcohol use, and lastly, with diet. So certain diets, specifically diets high in red meat and ultra-processed foods, and diets that are low in intake of fiber and whole grains, tend to have an increased risk of developing colorectal cancer. As far as risk factors that we have no control over, that's where genetics comes in. If you have a family history of colorectal cancer, you are at an increased risk yourself of developing colorectal cancer. If you have a family history of colon polyps, that's also very important to know. There are also certain genetic disorders that are inherited that give you an increased risk of developing colon cancer. Typically, these are familial cancer syndromes or polyposis syndromes. The last genetic factor is if you have a family history of, there are certain chronic illnesses that increase the risk of developing cancer in the gut due to inflammation. And these are inflammatory bowel diseases such as ulcerative colitis or Crohn's disease. So if you have a history of any of these conditions to begin with, or if you have a family history of any of these conditions, it's very important to talk to your doctor about that because it does affect your risk for developing colon cancer. When to see the doctor also becomes a question of when should you have your first colonoscopy. There are a couple different groups of people to think about. One group is people who already have a diagnosis of either cancer or polyps, or a history of one of those other diseases that we talked about where you are at increased risk. Chances are if you have one of these diagnoses, you're already being followed by a doctor and you are probably getting what's called surveillance colonoscopies. The next group of people that we need to worry about are people who have symptoms. Somebody who's having symptoms should get what's called a diagnostic exam or a diagnostic colonoscopy. So as far as symptoms that we consider to be potential red flags, blood in the stool or in the bowel movement, that's one of the major ones. Other symptoms would be what we call change in your bowel habits. If you are normally typically somebody who has a very regular pattern of going to the bathroom, and now suddenly you find that you are very constipated or even going more frequently, any type of change like that, again, mention that to your doctor. Also, if you have a change in the shape of your bowel movement, so if you notice that you have, for instance, pencil-thin stools or ribbon-like stools, that also is something that we want to be aware of. And then there are other symptoms that might seem a little bit more vague, like unintentional weight loss or fatigue. Sometimes fatigue can be a sign of anemia. Anybody who's having symptoms should at least be considered for a diagnostic evaluation, such as a colonoscopy, and that would be regardless of your age. We have unfortunately been finding an increasing trend of colorectal cancers being diagnosed in younger people. Back in the 1990s, only about 11% of new diagnoses were in people that were less than the age of 50 or 55. And by 2020, that number increased to about 20%. So currently, about 1 in 5 new colorectal cancer diagnoses is in somebody who is considered much younger. So if you are having symptoms regardless of your age, please reach out to your doctor to see if you need to have a diagnostic test such as a colonoscopy. So finally, let's talk about screening. When you have a screening exam, specifically a screening colonoscopy, we aren't necessarily concerned that we're going to find a cancer. That is actually pretty rare. It happens usually less than 1% of the time. Fortunately, if we do detect a cancer on a screening exam, typically it is a very early diagnosis, which does correlate with a better prognosis. But even more importantly, when we are doing a screening exam, such as a screening colonoscopy, we're actually looking for precancerous growths called polyps. What I usually tell patients is that your first colonoscopy is probably the most important because it establishes your baseline. Do you make polyps or not? If your colon makes polyps, then we know, okay, every couple years you need to get your colon checked out to see if there are any new polyps, again, to reduce the risk of any of those individual polyps becoming a colon cancer. Here at MUSC Health in the Midlands, we are happy to take new patients.